Hi ladies, my name is Julie and I'm a women's health nurse practitioner with Magnolia OB at North Oaks Health System. I provide health care to women through all stages of life, and I'm especially passionate about helping young women like you transition into womanhood. Today, I wanted to chat with you about what a lot of young women consider the most nerve-wracking doctor visit of their life, their first well woman or gynecological exam. To be honest with you, as a teenager, I was a little worried about the first visit too. I can still remember that day. Now caring for teenage patients like you is one of the most gratifying parts of my job. I know the unknown can be scary, but I hope what I share today will ease your worries and make your first visit a positive experience. A Well Woman exam is a medical visit with a women's healthcare provider to assess your health, answer your questions, and counsel you on how to prevent future health concerns. We focus on your reproductive health, addressing issues such as contraception, pregnancy, sexuality, and menstruation. The American College of Obstetrics and Gynecology recommends that a woman's first Well Woman exam should take place between ages 13 to 15. That may sound really young, but the truth is, building a trusted relationship with a women's healthcare provider is like having a really smart best friend who has the training and education to help you through every moment of womanhood. The first visit is all about getting to know you. We ask you questions about your periods, sexual activity, and health history. We also like to take the time to educate you on the importance of breast and body self-awareness, vaccines, and birth control options if you are sexually active. This is your chance to ask questions too. Keep in mind that this is a judgment-free, confidential zone. We want you to feel comfortable asking or telling us anything. A pelvic exam is used to check the health of your vagina, cervix, and ovaries, while a pap smear is a screening that looks for abnormal cells that could lead to cervical cancer. But I have some good news. For most healthy adolescents, pelvic exams and pap smears are not recommended until you are 21 years old and only every 3 years during your 20s to check for cervical cancer. While screening for cervical cancer might not take place on your first visit, it's important to know the causes of cervical cancer and what you can do to prevent it. Did you know that it's the 4th most common cancer among women, and the main cause is a sexually transmitted disease called human papillomavirus, or HPV? HPV is a common infection spread through sexual or skin-to-skin contact with an infected person. HPV can cause changes in the cells of the cervix. Over time, those cells can form cancerous tumors. But just like most cancers, the earlier cervical cancer is detected, the better the outcome. That's why pap smears are an important part of the Well Woman visit. The good news is there are several ways to protect against HPV. By limiting the number of sexual partners and using condoms, you can decrease the likelihood of getting HPV. Vaccines can also prevent you from being infected with the most common types. These vaccines are most effective when given at the age of 11 or 12, but are still effective even if you get the doses later on. If you have questions about HPV or the HPV vaccine, your pediatrician or gynecologist is the perfect person to talk to. Your first Well Woman visit is an important milestone in becoming an advocate for your health and building an invaluable partnership with a healthcare provider. Think of it as the start of an ongoing conversation to keep you healthy throughout adolescence into adulthood. It is the perfect time to find a best friend in your OB/GYN.